And I think that is something which we can all embrace. And through your podcast, I actually want to speak to all the young kids and the children who probably will watch this podcast that hey, no matter which background you come from, where you are in your life, and irrespective of your socioeconomic background, you have an enormous potential to make a difference in people's life.
Today's episode is for every young person who dreams of making a real difference in the world. We often hear about doctors, scientists, researchers, but very rarely do we understand the mindset, the resilience, and the purpose that drives someone to operate at a truly global level. Our guest today is not just a neurologist, he's a global health leader, a researcher, an innovator working at the intersection of neuroscience, medicine, and impact. He has been internationally recognized for his contribution to global health and research, and his work is influencing how we understand brain health and healthcare systems across the borders. But what inspires me most is this: he represents what happens when intelligence meets purpose. In a world full of distractions, he chose depth. In a world chasing titles, he chose impact. In a world chasing comfort, he chose contributions. It is my absolute honor to welcome Dr. Sonu Bhaskar to Rack the Brain podcast. Dr. Bhaskar, welcome to the show.
Thank you very much, Avi. I'm very excited to be here and I appreciate your kind invitation.
Look, I'm honored to have you because I'm a big fan of yours, the work you are doing, and there's so much we need to talk about in this podcast. As I mentioned, I've heard probably all the other interviews you have taken. I have seen a lot of your posts on LinkedIn. You are on a mission, you are on a journey, but you keep on touching upon how your childhood inspired you, the the tough situations that you saw, but you navigated, your role models in your family. How about we start with your childhood first before we deep dive into other topics?
No, thank you, Avi. I was, and you rightly said that, I often, embrace and actually are very inspired by my childhood and the people who influenced me in my life. It's because people like, uh, I think the childhood when you have sort of lack of limited or lack of resources, sometimes limited resources, people think that it might be a lack of opportunity. I actually think it is an impetus to pursue opportunity. It's an impetus to understand the difference between haves and have-nots and see that how our work can make an impact in our community. So I was born in one of the most remotest parts of the eastern part of India. It's a state of India called Bihar. And in those times, we used to have electricity for a few hours. And, we used to walk like kilometers to go to the school. And it was a time when there was a lot of strife in the society. Um, and but I, but in that little cocoon or sort of the space, I was very fortunate to have that presence of my grandfather, my parents, and through that I picked the value of service, and that the lack of resources became a sort of an impetus and an inspiration for me to see how do I maximize what's available, to see that I'm driven with this the hunger to make an impact in our community, and how do we give back. So that has been sort of the mantra that I have lived throughout my life, and since then it took me to a different journey, in medicine and neurology. But today, I'm I'm very humbled, and at the same time, and I acknowledge that a boy from a, one part of this, from this journey has is here, and he still carries the same fervor and passion that he used to carry at that point of time. And I think that is something which we can all embrace. And through your podcast, I actually want to speak to all the, the young kids and the children who probably will watch this podcast, that hey, no matter which background you come from, where you are in your life, and irrespective of your socioeconomic background, you have an enormous potential to make a difference in people's life. And a life with purpose is a life worth living. So whether you are in Blacktown or in a in a remotest part or a village in India or in Bangladesh or any other part of the world, um, make life an opportunity to pursue purpose. And purpose with service makes a life really enjoyable. And I think that probably is something which I am very grateful for, these experiences in life.
Doctor, you talk about purpose, right? Did you really know the meaning of that word at that young age? And who in your family constantly reiterated? Because when we were growing up, I think the purpose was to get good scores, the good courses for that stability in life and getting good jobs. But if I was talking to myself, what is one word that describes Dr. Sonu Bhaskar? That one word in my, I would say, is humility, because you haven't lost track of where you came from. You keep on reiterating in every interview. Probably that is what keeps you humble. But at the same time, you are able to focus on the purpose. How did that instill? Who instilled that in you?
I think there are two answers to this question. The first part being that you know when you endure challenges in life. As a child, I was neurodivergent, and I could understand what othering means. To be different from others, and um, you know, as you said that there is a sort of a mentality among individuals that we all have to behave in a certain way, chase the same dreams, be a part of that, and that is okay, and for many people. But I think my journey probably is about that. It is also okay to be different and not to chase what everybody is chasing. To chase your dreams is not just about what others have thought about you, but actually to define your own dreams. So I was never given a dream by others in my family, but I was given a purpose, and that purpose is the second part of that story, which is I had a sort of a very nurturing relationship with my grandfather, my late grandfather, who I had great opportunity to travel with in my life. And these travels were sort of like very philosophical in nature. We will talk about history, about science, about philosophy. So that gave me a perspective about that science is important. But science without philosophy, without ethics, is like a rudderless horse. And so I'm very grateful to my great late grandfather to instill that sense of value of service and purpose in doing what I do. And through those conversations, and I still, when I reflect on my those conversations, I think about those moments when he taught through little subtle things in life that who you are is not defined of what you achieve, is defined by the difference that you make in people's life. That purpose, that yearning, that hunger, that everybody looks after himself and otherwise. But then, but when you take a break from this mold, the mold that others have defined for you, or you sort of like inherit this as a legacy of being sort of trying to fit in it to that mold, you would get this appetite that, hey, I don't have to fit in, but I can celebrate who I am. I can celebrate the difference, but with an absolute hunger that, my work and my heart is at the right place, that it is connected and I could make a difference in people's life. I think that probably is the greatest gift of my grandfather. Um, I had great times with him conversing about the history of India, the Vedantic philosophy, um, and we used to go through different aspects of some of the greatest philosophers, the Rousseau, the Voltaire, the Montesquieu's of the French Revolution, and and in those deliberations with my my late grandfather, who was a very highly learned human being with simplicity. Um, and he often used to say that these individuals were commoners, but the fact that they made a difference in their community that defined the times that we live today is an absolute celebration of human resilience.
Beautiful.
No matter which part of the world you are from, because a Rousseau or a farmer sitting in France, or somebody like Tagore. I was recently in Kolkata a couple of weeks ago, and I visited the Thakur Bari, the place where one of India's greatest son, the Rabindranath Tagore, Nobel laureate, a great philosopher, he was born, and he also died there. But still in the windows and the streets there, the Thakur Bari, you can still feel the sort of the enormity of his aura, his presence. He was hungry for service. And Tagore, in his writings, in his music, in his paintings, Tagore was a great musician. Rabindra Sangeet still defines much of the life in the eastern part of the India and Bangladesh and many other countries in the world. His philosophy inspired the works of many other philosophers in Europe. He was a great advocate for, and he stood up against anti-Semitism. He was a great philosopher, but also a statesman. And when you look at the individuals like this, you see that it doesn't matter where you are, when you come from, but that shared value of service is a common denominator.
Amazing. You really put in a beautiful perspective. And you set me thinking about your visit to Calcutta. Isn't it amazing? Doctor, in one of the interviews you mentioned you used to walk 4 to 5 kilometers every day, and then you would teach your brothers and sisters as well. Obviously, those are not easy days. But at what point did you decide you are going to go into medicine, and why?
Um, See, growing up, with my, you know, uh, with my brothers and I always loved teaching because, um, um, when I remember when I was in year 7, I had this appetite for doing mathematics and biology. I used to study, the books, the books of Feynman and some of the greatest physicists, mathematicians who were much above my, let's just say, pay scale at that time. But I was just curious as a child, and one of the things I realized that learning is not just what you do for passing exams or otherwise, but learning is about what you digest and how you share that digestion with others. It's like, um, that A plus B equals C. It's a common sort of mathematical formulation. But understanding that A plus B equals T can also be understood in the perspective of the arteries and the veins talking to each other and mediating different parts of the capillaries to define the microvasculature in the brain. That is an extraordinary form of translation of that simple mathematical formula to something which can impact our human life. And teaching became something very quintessentially a part of my learning curve. So I used to teach my brothers and sisters. I even used to teach some of my classmates. Um, and And at that point of time, I realized that I have a sort of passion for going beyond what is known to this, because I always ask questions to myself. And and when I used to go to the school, and my teacher would have a mathematical equation written on the board, and he would actually write the sort of, this is the way that we can solve this mathematical formulation. And I often used to raise my hand and said, can we look at it differently? This is probably the another way we can apply this, sort of differential to reach at the same conclusion. But can we radically innovate? Because in that the moment of radical innovation comes an appetite that, hey, we can think about this in different way. We don't have to follow the same ways. Because if we all follow the same, there would be no Newton, because the apples and oranges fall all the time. But that sense, that the mindset of presence, that there is an apple that is being pulled by a center for gravity, and that is being defined by G m1 m2, by r square. But that gravitational force was, sort of an anomaly at that time. But his appetite for that innovation, to think laterally different from others, and his presence was probably what gave us the gravitational force, and so on and so forth. So that drove me to that, among all the disciplines in human mind or human brain or nature, there's a part of that identity, or sort of, where we lack understanding of where it is, and that's the human body. And within the human body, there is this little tissue, which we call human brain, that is so complex that billions of neurons sit there determining your personality, your identity, your cognition, your thinking. And that is an extraordinarily sophisticated sort of machinery. So if you apply, no matter whichever engineering construct you can, we are still able to figure out the complexity of human brain. And I think that was something which was, you know, how I got inspired with medicine. And specifically, you know, because in medicine, I saw a journey where, science meets service. That medicine is not just, about those formulas, about the understanding that how brain talks to the kidney and how it talks to the heart, but it is also about application of that knowledge in improving the lives of of members of our community. Figuring out that challenge that every patient is different, every diagnosis is different, and it intrigues me that often we say that that in sort of a doctor-patient relationship, you always approach each patient with a curiosity. But I actually feel humble that that it's quite every patient humbles you as a doctor, as a physician, because it teaches you that the human brain, the complexity of human body is something which is of extraordinary marvel. And that I think is has probably driven my my passion and led me to medicine, and of course then to neurology. And among all different parts of the body, you know, there are so many cerebrovascular disorders, brain disorders, we still don't have answers to. We know very little about them. Many of them, what we call cryptogenic, where we don't know what caused it. We don't know the mechanisms of that. We know sort of correlation, but we are still trying to find out the causation. We're still trying to find out underlying mechanisms. And and that is something which is an enigma, right? It's like the Newton's curiosity, or the Shushrutas, one of the greatest Indian physician, often called the father of modern surgery. In his greatest book, the Shushruta Samhita, which he wrote centuries ago, and he documents in great detail these surgical equipments, instruments that can be used with extraordinary, meticulous precision to do rhinoplasty. And that is a brilliant piece of innovation. a sort of, um, that 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 we, with our knowledge systems and this um, yearning to innovate that knowledge system, existing knowledge systems, can totally redefine who we are as people. And through that yearning, we'll be able to address many of the diseases, sort of, which is still in the cryptogenic bracket, unknown bracket. And hopefully we can address them, better diagnose them, better treat them.
You still seem to be so excited about human body, brain, which is phenomenal. And I'm hoping the youngsters who are seeing this understand that it's not just about going into medicine, getting a cushy job and comfort. The reason I say this is because in my profession, I get to talk to so many youngsters, and when I ask them, why do you want to be doctors? They're on they're on good selective schools, they're top of the class, and they say, because medicine pays you well, it's stable, AI may not take it over easily. And that leaves me with the thought that, is that really the goal of why you want to become a doctor? So I hope this discussion of ours inspires them to understand the bigger goal is not just a cushy job. Amazing. So, Doctor,
On
help.
that, if I can
Yeah, please.
just chime in, that, that medicine, like any other profession, is a profession indeed. But I also think it's medicine carries with itself a deeply ingrained value of service. Medicine is about service. And I'm very grateful to be in medicine, because that has taken me to the remotest parts of India, to Africa, to Kenya, and in the, to far and wide, to speak to the people in so many different languages, to be able to connect and empathize with them, to be able to find solutions to the suffering that they endure in Japan, in Australia, in India, and in other parts of the world. Tell me a profession that gives you this, this journey to be part of this movement, international movement, to make a difference in life. So I agree with you that there is this, in modern contemporary terms, when we chase sort of, one aspect of human life, which is important, financial stability, but often forget that there is, you know, there is this service which is deeply embedded in human. And I'm thinking about the great physicians of our times, whether it was Shushruta, whether it was just, Santiago Ramon y Cajal, who was one of my greatest inspiration in medicine. He was a Spanish neurologist, and and he, with his hunger for understanding that how the brain neurons talk to each other, and he redefined the how brains neurons communicate with each other, and in the way he actually redefined our understanding of human brain in his great treatise called the La Textura del Sistema Nervioso, which is the Spanish for, the understanding of human nervous system. He goes on to detail, because through his little microscope, he went on to understand and paint the neurons in cats, in mouse, and other species. It's an extraordinary, form of work, and that, I think, goes beyond this, one sort of value, but it forays into, or goes into this territory of, of innovation, of service. So I think medicine is a profession which gives you a great pathway to make a difference in people's life.
Wow. And Doctor, which college did you study in India?
So I was, I moved to the south of India, and at that time, at Madras, I was very fortunate that there was, in Europe, there was one of my friends. He introduced me to this national scholarship in Spain, where they were giving full scholarship to study. So then I went, and in the northernmost part of Spain, close to the France border, And there, my journey started from Spain. Then I moved to Netherlands, and I specialized in neuroradiology and neurology. And then I moved to Germany, and 13, 14 years back, I moved to Australia. I spent a couple of years in Newcastle, which is in probably 4 hours from here, and then I moved to Sydney. And last couple of years, I've been in Japan.
Doctor, you're doing a lot of things. Can you please help me understand and the audience understand a summary of what all you do? Because there's so many things you do, right? So if you can help us with the summary of what all you do, some of the projects you are undertaking, and then obviously we move to your blood clot bank. So
Definitely. Thank you. Essentially, I'm a neurologist, and I specialize in a field of neurology called vascular neurology, which is basically to understand that how the brain vessels or the vasculature, whether it's the blood arteries and the veins, how they contribute to human disease and human function, a brain function. And there are a lot of diseases, specifically in the contemporary, in the current times, that are the incidence of these disorders are increasing. One being stroke, which is a disease that is caused by lack of oxygen in the brain, and that is primarily caused because you got a little clot in the brain, which is called ischemic stroke, that causes an interruption to the blood flow in the brain, and that leads to a sort of suffering. It's like, imagine that if you got a fish and you take the fish out of the water and it can't breathe anymore. So many of the neurons, they need oxygen. And when you deprive the neurons from the oxygen, they eventually die. And we call this phenomenon ischemia, brain ischemia. And it is caused by two important sort of events. One being the blockage of the artery in the brain, or the blockage of the artery in the heart, that leads to the interruption in the blood flow to the brain that causes, we call this ischemic stroke. And the second being the hemorrhage, which is the bleeding. So imagine a blood vessel in the brain and it got nicked a little bit, a sort of a fracture, sort of, a breakage. And that leakage leads to the blood being spilled into the brain parenchyma, what you call the bleed. That stroke is called a hemorrhage. It is responsible for, a very high level of mortality or death in many people who suffer it. Thankfully, the hemorrhages are a small part of the total bucket, and the majority of strokes are primarily caused by the ischemic stroke, which is because of the interruption in the blood flow. So stroke now, because of the growing, vascular risk factors such as blood pressure, hypertension, what you call it, diabetes, and our food habits and obesity, the incidence of these strokes are increasing. And that is leading to even we are witnessing an increase in the stroke in the younger population. Often you would have noticed that stroke happens in the elderly, but now it's even found in the younger cohort of patients. So that so this branch of neurology, which is vascular neurology, is quite interesting and intriguing. Is because many of the traditional diseases in brain, dementia, Alzheimer's disease, Parkinson's disease, multiple sclerosis, where our understanding of these diseases were defined by Alzheimer's, for example, that these are caused by agglutination or sort of deposition or of particular proteins, amyloid and amyloid proteins. But now we are understanding that that a section of these diseases which remains unaddressed or sort of unanswered, even with the previous understanding, there is a role of human brain vasculature in that, and that is what vascular neurology does to help identify the vascular contributions. And also among all the other disciplines in neurology, this is a field that has dramatically changed because now we have treatments available. Stroke, 20, 25, 30 years ago, there was very limited treatment options available. And today we have a treatment called the intravenous thrombolysis, which is a drug that when the stroke happens, Imagine that every minute that stroke happens and the neurons are dying. So the goal in stroke is to prevent the neurons to die. And you do that because there's a drug that's called transplasminogen activator. It's called the thrombolytic drug, which is a drug that, when injected, it goes and unblocks the artery. So it dissolves the clot, which is blocking the artery. The clot gets flushed out of the artery, and the blood flow to the brain is restored. In simple terms, so it was a game-changing treatment for stroke. And since then, now we are able to sort of patients who would otherwise live with lifelong disability, or many patients who will die. Now we are able to treat these patients. And in last decade, we also have seen another treatment that is now has also dramatically improved the quality of life of these patients, is what we call the endovascular thrombectomy, which is sort of a mechanical procedure in which we mechanically enter the brain vasculature through the radial artery, or you can actually navigate to the particular um, part of the vasculature which is being blocked, and then physically retrieve the clot. So then you can get the clot out, and the blood flow to the brain is restored. So that procedure is called endovascular thrombectomy. That is also game changing. So this is something which is, in comparison to the rest of the brain disorders, where we are still sort of in the space of improving the quality of life of patients, but we still don't have a sort of a treatment that can dramatically improve to an extent that we can do now with stroke patients. So that little thrombolytic drug now can dramatically improve the quality of life, which was not possible before. So this is really an exciting part of him, and the incidence of these diseases in India, in Australia, in rest of the world is increasing, and it is also associated with dementia and other brain disorders. So when not treated, these patients will go on to have dementia and Alzheimer's disease. It increases risk of other neurodegenerative conditions, including Parkinson's disease, so on and so forth.
Doctor, you mentioned it is also increasing in young population. What is the reason for that?
Great question. I think one of the reasons being, hypertension. So in simple lexicon, you can call it the high blood pressure. High blood pressure is an enemy to to human brain, and also to our blood cells, because high blood pressure, hypertension, essentially puts you at a high risk of stroke. It puts you at high risk of other cardiovascular conditions, emergencies, heart attack for that matter. Other being the diabetes. So you're witnessing, a rise in diabetes in younger populations in South Asia and other parts of the world. And it is, and this cocktail of diabetes and hypertension, which often come together in a lot of patients, it compounds the risk of patients to be, at a high risk of stroke or cardiovascular emergency, heart attack for that matter. So, there is what we are witnessing is sort of a demographic shift from that elderly population now to the younger population. Also, there are other risk factors of of the lifestyle changes that we are witnessing, obesity for that matter. Stress is also an important factor. And these changes, they all work in sort of like, they talk to each other in a way. So one risk factor, talks to the other risk factor, and it compounds the overall impact on this, cardiovascular emergency. So we are witnessing this demographic shift in this space. So that is one of the reasons that we are witnessing the increasing incidence of stroke and other cardiovascular emergencies in the younger population, younger cohort.
Doctor, this reminds me of one of my guests. I interviewed him. He's the founder of a company called AdLife. He's based in Adelaide, and he has been working on this for the last 10 to 12 years. He focuses on the stroke patients, one of the side effect of stroke is your parts of body might be paralyzed if the action is not taken on time. And there's an amazing story of a 23-year-old boy, Sam, who was wheel-bound because of stroke. And then this guy is using virtual reality, the games in the virtual reality, to heal those patients. And I've played that game myself. What it does is it has got different levels of games, and you got to use your hand to build that, the power in the muscles, and you keep on scaling the levels. And there's a story of how Sam went from being vegetative in this journey, and over 1 year he was able to stand and walk. So it's now it's all coming in together, that there are so many ways to address this, and gaming is another way of looking. I don't know if you've heard about, but maybe I'll share his details to have a look what he's doing. You mentioned about
On that, by the way, because you mentioned about virtual reality, there is now emerging evidence that virtual reality is being used in the post-stroke phase, which is after the stroke, and also in traumatic brain injury patients. So patients who endure traumatic injuries, blast injuries, or injuries to the head. Uh, and these patients, of course, some of these patients suffer lifelong disability, paralysis for that matter. Aphasia is another. And now we are seeing that, with these interventions coming up, one being virtual reality, then there are robotic, interventions that are being studied and implemented in these patients. You see that there is now an understanding that these interventions and it can have an impact in improving and regaining some of the lost function. And this brings to us to a very important and quintessentially a very important aspect of human brain, which is called neuroplasticity. Neuroplasticity is that a traditional understanding of neurology and neuroscience was that the neurons die; they don't regenerate. The ones they're dead. But now we are emerging understanding that there are some parts of the human brain where we can there is a phenomenon called neurogenesis, that we can stimulate these neurons to start talking to each other.
interesting.
So one part of the brain, even if that there is a lack of or death of our neurons in one cluster of the brain, but we can stimulate the conversation from that temporal cortex, so which is with the other part of the brain, and that network, which is the cross talk between one part of the other part, helps restore some of these functions. So if there is a stroke on the right side of the brain, then the left side of the brain starts chipping in, taking over some part of that function.
Mm.
And now we are, the neuroscience, further imaging studies in neuroscience are proving that human brain has this capacity of neuroplasticity to be able to, reorganize its functions, which it challenges the traditional construct that motor cortex is only responsible for movement. But there are other parts in the brain which can also be, is as essential in mediating the movement per se. And that is an emerging and very exciting field of work where we can improve the life of these patients, such as in post-stroke setting, post-traumatic brain injury settings. So this is a thanks for sharing this. The virtual reality does have a great role to play, and I would see that there would be more studies in this area.
Doctor, I want to also, the question I had was around how important are the first few hours of stroke, and how does one even know there's a brain stroke?
Right. So, as I explained to you before, that stroke is because of the interruption in the blood flow to the brain, and put this in the common lexicon again, that every minute delay in getting the right treatment in this context, billions of neurons die, and because of death of these neurons, There are many other parts, other things associated, like myelin sheath, for example. They are also impacted. So, and when these neurons die, a part of the brain dies. In a simple words, not verbally translating, but in simple terms, you can explain that in that way. And and when these neurons die, they deprive the body from that function that the neurons are carrying out. Whether these are neurons in the motor cortex, which is responsible for your movement, or these are the which is responsible for cognition. So depending on the location of the brain, that a part of the brain function gets impacted, and that is that deprivation of the neurons to consume oxygen, that has a long-lasting impact. There's also a phenomenon in the human brain which we call hypoperfusion, which is that in some patients you witness that there is a chronic phase of sort of hyperperfusion, that the blood flow to the brain is interrupted, and to the levels that we expect them to be. And if it prevails over a longer period of time, that leads to stroke and many other medical emergencies. So, and the vascular risk factors that we discussed before, hypertension, diabetes, are all contributing factors that leads to this condition.
And can you please repeat the name of medicine, which I would strongly recommend people to be? Is it available on shelf so that they can buy and keep it at home just in case?
Uh,
When somebody has a stroke, you mentioned about the medicine.
No, so this medication can only be given in a comprehensive stroke center or a nearest medical hospital. It's called transplasminogen activator. It's like alteplase or tenecteplase nowadays. There are two different variants. And basically, this drug is a thrombolytic drug. It's a clot-busting drug that needs to be given by a treating physician, a neurologist, after a number of tests that they perform. So common tests that we perform at that time, including the blood test, we got to see in imaging, because imaging is important. So what you do is you get the brain imaged under MRI or CT, and in CT imaging, which is computed tomography, there is a part of a modality which we call angiography, which is the brain scan for the blood vessels in the brain. And in the CT angiography, we are looking at which part of that brain vessel is clogged, or there's another imaging variant which we call non-contrast CT, where we are looking at if there is a bleed in the brain. So to determine whether it's a stroke because of hemorrhage or a stroke because of ischemic stroke. Is it because of the clot or is it because of the bleeding? So remember that drug can only be used in the ischemic stroke patients. But the challenge with using this drug, that it can only be used within 4.5 hours from the onset of stroke.
4.5 hours.
So from the time when the first symptoms often are that you would see a sort of loss of function in how you speak, and the weakness in the arms or the legs, in the limbs. These are common symptoms, which we often understand through an acronym called FAST. So when you witness these classic symptoms of weakness in the arms or the limbs, stammer, if that, when you lack of function in the how people speak, and the first thing when you notice these stroke-like symptoms is to take the patient immediately to the nearest hospital, because that time window is critical. It's life-saving, because if you get the patient within the 4.5 hours, they are eligible to get this treatment, the tissue plasminogen activator, where this drug, which goes immediately into the bloodstream and then flushes the clot out, and the patients can get on with their lives. They can be discharged in a couple of days. It's a life-saving treatment. But the challenge there is that this treatment can only be given in that very restricted time window. The reason being, if it crosses 4.5 hours, we know from the previous studies that it is associated with increased risk of bleeding. So beyond that time, if you give this drug, the patients might bleed and sometimes may bleed to death. So it's got to be given in that strict time window, first of all.
And I'm curious, sorry to interrupt. Do most people miss that time window?
A lot of patients miss the time window, and and many patients are not eligible for this treatment. But the good news is that now there is a growing understanding that beyond time, the time is of course important, that you got to give in. There is another approach that is evolving in medicine, which is about tissue-based imaging, a tissue-based approach, which is that time is important, but tissues is also important. And how do you quantify tissue? By imaging. And we can determine whether there is still viable tissue there that we can preserve. So when stroke happens, we call a phenomenon by which that there is a core. Core is the part of the human brain or the neurons which is already dead. That and there's no purpose to save these neurons because it's dead. But around that core is what we call the penumbra. Penumbra is part of the tissue which is, imagine it's like a green line. They are getting less supply of oxygen, but they're still breathing. We can save this. And the entire goal of this treatment is to get to those neurons, like a firefighter. Get to the neurons, save the neurons, and you essentially save these patients. Other good news is the last couple of years, now we have a treatment called endovascular thrombectomy, the mechanical procedure. But it needs to be performed by a trained interventional neurologist or interventional neuroradiologist or a radiologist. In this process, what you do is that you actually physically, mechanically go inside and then retrieve the clot. And now you can perform this procedure all the way to 16 to 24 hours. So that time window, which was restricted before, has now been expanded.
Great.
In this. So this new treatment can be made available to patients all the way till 24 hours after the first symptoms of the stroke happened. That is game-changing. So imagine that how many patients we can help. But unfortunately, and it brings me to the second part of my work. First being the neurologist, but the second part of the work is that I'm very deeply involved in global health, because one of the gap I found in medicine between haves and have-nots. So while we have this treatment called thrombolysis, this treatment is not available in many parts of the world because it's expensive. And despite that, this being a game-changing treatment can make a humongous difference in the lives of individual patients and overall, the health of the society, there is a lot of disparity. So one of the things that we are doing is to make the access, availability of these drugs and treatment diagnosis equitable to other parts of the world. That the patient in a village in India or in Africa should have or gotta have the same access, equitable access to diagnostics, to get the right diagnosis at the right time, to get the right treatment at the right time. And that's the goal of global health that we carry, to make these innovations in neurology that we are doing in one part of the world accessible to other parts of the world, where there are still great differences, where some patients with stroke are still, we have limited options. Even some patients get just like aspirin, despite that we can actually save lives of these patients and dramatically improve their quality of life. They don't have to be paralyzed for the rest of their life if we get this drug into those hospitals, into that community. And that's something that brings me to the second part of our work is global health, where we do medical camps. We are teaching doctors in Africa. I was recently in West Asia, in Kazakhstan, training next generation of doctors, emergency physicians in these, so that the standards of care that we have here in Japan can be sort of transposed in other parts of the world. So train the physicians there. And the second is to improve access to diagnosis and treatment. And in global health, one of the things that I realized that no matter what we do on individual patient level, we also got to work on policy. So that has been essentially an important part of my work in last 5-7 years. That I sit on various panels, international panels, trying to influence policy in equitable access to these. So I sit as the founding chair and founding member of Global Health and Migration with the Global Health of Germany in Berlin, and many other international organizations where we are trying to influence policy at national level. That these diagnostics, to get the right diagnosis of dementia. Imagine this: in many parts of India, many parts of South Asia, it's not that there were patients who were not suffering from Alzheimer's disease, but many of these patients were not treated, were not diagnosed. Where they could have been diagnosed early, they could have got the right treatment early. Many of the patients who never got a diagnosis of stroke, they were sitting in the fringe because they never got the right treatment, lived with paralysis for the rest of the time, never diagnosed with a stroke. What if we change this with providing the access to CT imaging in those parts of the brain, of the world? That once, I think, when we often talk about equity, we talk about dignity. Medicine is about dignity. To get the right dignity, to have the right access to that diagnosis, I think it's every patient's right to have that dignity of diagnosis, dignity of treatment. And global health, puts that dignity back to the patients. And that's something which I'm deeply passionate about.
I'm having goosebumps. You know why? Because this topic is so close to me. I've had friends and family who have been victim of stroke. I know a few people in Sydney. I lost a family member because of brain stroke. Yeah, I want to talk about you are the founder of the world's first Brain Clot Bank. And I'm really keen to know the impact you have made and the purpose of this bank and your journey so far. And obviously after that, we'll talk about the type of clot. So help me understand more about your initiative.
Well, imagine this, that if you have a part of the human body or human vasculature, which is you got this of the size of a grain, rice grain, a size of a little size of the grain. That size of the grain can make such a negative impact if it is that clot, which is very small. But when it gets to the wrong place, when it blocks an artery in the brain, when it blocks an artery, the coronary artery or the carotid artery or the middle cerebral artery in the brain, it causes the stroke. And the consequences are devastating, as you rightly said. I'm so sorry that you and your family members have to experience it, because that little clot becomes the devil at that time, severely impacting the quality of life of it. Many patients don't survive. And those who survive without treatment, they live lifelong disability. But then the good news is that there's also an opportunity, now that we know the problem, that clot causes the stroke, we have an opportunity to address this problem. And that is why, when rather a part of the human brain was that before, when we used to give these treatment to the patients, endovascular thrombectomy, which is mechanical, where we take the clot out of the human brain vasculature, brain vessels. But most of these clots were then discarded unless you have specific indications to go and look at those clots. They were thrown away, but they were not really part of the decision making in human medicine. And this was really intriguing to me, because that made me to think that, hey, why don't we do this? That in stroke, we know that the stroke is caused by the blockage of an artery in which we call large artery atherosclerosis, because of the blocking of the artery, the phenomenon that we call atherosclerosis. But we also know that some strokes are caused by cardioembolic causes. So they actually emboli, they shoot off from the heart, they go to the brain and then block an artery, and immediately the stroke happens. But there is a bucket of stroke that are not caused by these two mechanisms, or probably a cause, but we don't know what is the cause of these strokes. And these strokes are called cryptogenic strokes, where we don't know the cause or underlying mechanism of these patients. And one of my patients who, um, you know, um, despite extensive investigation, imaging and blood tests, we were not able to determine what is the cause of this patient. And that was the reason that we started this, that now we have this avenue to get the clot out of why don't we look at these clots and understand where they came from? And that led to one of the world's first initiative of harvesting the cerebral blood clots that causes stroke. But that essentially, with the humble beginning here, we went on to see that looking at these clots can help us understand their biology, can help us to understand that that can we solve this puzzle of undetermined diagnosis of these patients. Because now that we know we can diagnose these patients, then we can change the treatment. We can provide the right treatment of these patients. So getting the right diagnosis is critical in medicine. But what if we can't give the diagnosis? That is a challenge. When we make the right diagnosis, we can provide anticoagulation drugs to these patients, which can be game-changing for these patients. So getting the right treatment is really about delineating the cause of which actually led to that particular diagnosis. So this was at the foundation of the Brain Clot Bank. And then, when we started with humble beginning here, and, many groups around the world started picking it up, and it became a sort of, they were curious, and then it started making a difference. Subsequently, we started with our collaborators in UK, in Liverpool, in Walton Centre in Liverpool, satellite biobank there as well. And, understanding, now we are, planning to start a satellite biobank in West Asia and Kazakhstan as well. That how we can use and harvest these clots to make it improve. And subsequently, independently, now many other centers in the world are now starting to look at this more carefully, because it has a great potential towards what we call, precision medicine. That every patient is different, every diagnosis is different, and by looking at the architecture of the clots, the composition of the clots, we can help determine the cause of the stroke. We can help determine the cause of the cardiovascular disorders. And that is game-changing for these patients. It's really about getting the right, getting the dignity back. That not knowing is something which, most patients are grappling with. They all suffer, but not knowing what I'm suffering from is like, and I think that getting the right diagnosis is about dignity to our patients. So Brain Clot Bank was really an initiative in that regards. And, I'm very humbled, but at the same time, because it was driven with this purpose to make a difference in lives of stroke patients, it is now being used and leveraged to see if it can be applied to many other cardiovascular disorders, myocardial infarction, heart attacks, many other cardiovascular disorders. And I hope that, we will continue to make advancements in this field to make a substantial difference in lives of our patients.
Amazing, doctor. You mentioned about the types of clots. Your initiative, your bank has made it so much. It has brought the clarity on the types of clots. What are the type of clots, and which one is most common, which you see in most patients? Can we talk a little bit about that?
Yeah. So the clots is basically, you got these clots. Clots are composed of red blood cells, the RBC, and white blood cells, and with fibrins and many other constituents. But the composition of this differs from clots to clots. Some clots also carry bacteria, bacterial vegetation. Some clots carry the clusters of these bacterial vegetation. And because of the constitution of these clots, some clots are hard clots, and some of them are, rather more liquidy, if you call it. It's difficult to hold them, but some are hardened structures, fibrin rich, and the clots that are hardened, they're easier to emboli. So they go from one part of the blood vessel to the other part of the blood vessel. So they cause, and block an artery in other part of the blood vessel, cause a stroke. And in some patients, they cause multiple strokes. So even if if you're, while doing the procedure or some way, even if you retrieve one clot, maybe a small fragment of that clot embolized from that part to another part, a small artery, it causes another stroke. So these are, little, as I said, size of a little, size of a white, the grain of rice, but enormous impact on the human vasculature. And these, the size of the clot, the constitution of the clot, their makeup, whether they're infected or otherwise with bacterial vegetation, all of these, inflammation for that matter. Because when you have these clots, then you also see inflammatory cells around it. All of these factors, their constitution, biochemical makeup, all of this influences how they interact with human brain vasculature or cerebral vasculature or cardiovasculature, and thereby how they cause and influence a human body.
Great. Doctor, I've come across this discussion where, the colleagues in the office or friends, when they sit around, they talk about possibly one of the reasons why people are getting clot is the COVID vaccine. Have you ever seen any correlation between the stroke patients or the stroke cases going up after the COVID vaccination?
No, I think this is a great question, and this is important that more people in the community get to understand this. That there's increasing, we are witnessing increasing rise in misinformation in the community. Is because some members of the community might not be aware of the biology, and that's why it's important to understand that what causes stroke. So vaccines don't cause stroke per se. The COVID itself, the virus, exposure to the virus leads to a cascade of events. As we saw during the COVID-19, there was an increasing incidence of stroke because of the virus infection. Even before when the vaccines came into vaccines are life-changing interventions in public health. Imagine when in our communities when we had polio, and you could relate a couple decades ago, because of the polio virus, individuals in the community, families were impacted, and the families lived with this burden for the rest of their lives. And at that time, when the polio vaccine came, there was a segment of our society which were, debating about the futility of these vaccines. And today we have wiped out polio from the world, except a sporadic 1 or 2 cases that we have, that has been found and in Pakistan, a couple of cases. But otherwise, the polio has been eliminated thanks to the international efforts to provide the right vaccine to the patients. Similarly, when you have an exposure to the virus, which is now endemic, a lot of patients in the community, most of us, in one way or the other, now we're exposed to the COVID virus. SARS-CoV-2 is within us. Now, viruses are what we, if you remember many of when in the early variants of these viruses, because we did not have the immunity to fight these viruses. We did not have the early phases of the pandemic. We did not have the immunity to fight these viruses. And because of our comorbidities, hypertension, diabetes, that also increases the risk of our capacity to endure it. That's why 2 individuals in the society having different severity when they were exposed to the virus. One patient is severely sick, goes on to die, and other is, probably less affected. Because each one of us have different levels of immunity. And you saw that because of the exposure to the virus, the risk of stroke, because the COVID, exposure to the COVID virus can lead to a phenomenon which we call the cytokine storm, increase in the presence of inflammatory biomarkers in the body. And these cytokines, when suddenly there is a peak, that causes a cascade of events leading to cardiovascular emergencies, heart attack, myocardial infarction. And when you're protecting this, now the virus, you don't have the immunity, suddenly you got the vaccines were developed and now you're able to provide that immunity to the body. They are protective. They are protecting your body against these infections. So this, understanding or misunderstanding that the vaccines lead to a lot of studies, international studies that we also participated in, looked at large data sets to understand if there's a difference between patients who, who took the vaccine and those who did not take the vaccine. There was no association found to implicate that there was, any role which connects the or rising incidence of this. The reason that you're witnessing rise of the stroke in the younger population or otherwise is because even before the COVID pandemic, we are witnessing a demographic change in our populations because of exposure to unhealthy dietary patterns that you're witnessing, increased in preservative in our food pipeline, exposure to smoking, a lot of younger populations exposure to smoking, pollution for that matter. All of these environmental risk factors have suddenly, in many parts of the world, we are living in toxic levels of pollution. These toxic level of pollutions, they interact with our human vasculature, causing atherosclerosis, acceleration of the blockage of the arteries, hypertension, increased blood pressure. How many of the patients, if you look at the rising incidence of hypertension and diabetes in the populations, look at the last 10 years, even before the pandemic. So to make this association that the vaccines are causing this is something which we need to, really think about. And the data and science doesn't stand to the scrutiny. Science is very clear that vaccine doesn't lead to these events. Vaccine protects your body, helps you to have the right immunity to fight these viruses. Now we know that because we raised this question in many parts of the world, there is now talks about this national level. Even India implement HC, the humanopapillovirus HPV vaccine in children, and we know from the data that the first approval of this vaccine came in 2006. We have data from last 20 years in the populations. In Australia, we have been able to eliminate cervical cancer because of this vaccine. In many parts of the world, in Sweden and in UK, because of the implementation at the national level, we were able to eliminate cervical cancer or significantly reduce the incidence of cervical cancer. And that is game-changing. You look at what the policy of rollout of the polio vaccine or measles vaccine did in those populations that were affected because of it. So vaccines are one of the greatest public health interventions that we can provide at a population level to protect our populations from these devastating diseases. See, viruses don't come from outside. Viruses are there inside our ecosystem. One time or otherwise, we'll be exposed to it, or we are already exposed to it. Some of these viruses are sitting within us, in dormant phase. And then, because of our environmental risk factors or otherwise, at one point of time, they may become active. They might start it multiplying, and we got to have the right immunity to fight them. So it's not that these viruses will stop. There's many viruses that we are still not exposed to. At one point of time, you will see that, more we are trying to destroy our ecosystem or, impede on the wildlife. And animals have a different level of immunity, different sort of immunity. They might have the immunity to fight these viruses. But what if these viruses jump from one particular species into humans? We are not prepared for it. And that's why, because of the lack of prior knowledge, it's like imagine you, an individual who had never been to one part of the world, suddenly been put in a flight and juxtaposed to a completely different new surroundings, but he's not aware of it. He might just make a mistake or otherwise. But once he gets used to the surroundings, he knows how to navigate it. Human body is that, curious learner. It learns over time. It learns to develop the right immunity. Sometimes it needs help. Vaccines provide that help to get the right immunity to fight these viruses.
Is that called the herd immunity?
I mean, now many of these, we have become endemic.
Yes.
So we all have the immunity. We all have the exposure to the viruses.
Doctor, does that mean COVID is not one-off? There's a high chance it could happen sometime in future as well if some new kind of virus comes in?
Absolutely. Because, the COVID, these viruses, the relationship between viruses and humans has been a long debate in human medicine, of course, in the human history, in history of medicine. We have had long battle with the viruses. There was a time when a huge, large number of part of our population where if you remember that the previous exposure of these viruses wiped out an entire population in Europe at one particular point of time. And over time, then we developed the right immunity, either because of vaccines and once it became the herd, a part of endemic to the population. But it took us time, and it is possible in the future that some of these viruses might mutate. They might mutate to worse variants in the future, or else we might be exposed to variants that we are not aware of. New viruses in species where we have limited exposure to, and when we increase our exposure, some of these viruses will jump from those species into human species. And and as I said, that those species might have the right immunity to fight those viruses. That's why they don't affect those animals. But once they jump the ship, and the havoc starts. Till the time the ship knows how to manage it, and that is the part of the wrestle, the quest of human medicine, is to get to the virus before it gets to us. To tame the virus, for that matter, and that takes time. And as you saw, and I think it's, we should be so grateful to science and medicine.
I agree.
This is one of the greatest quest of human life, that because of the feats and the success of our science and research and innovation, the international community was able to chip in such a short span of time to develop a vaccine that could save and has saved millions of lives around the world. I can't think of a part of the world where COVID was not wrecking families. We saw that what happened in Italy. We saw that what happened in India. All of us. We lived through that time of our life when, we were living in literally lockdowns in some part of including in Australia. So these viruses has a potential to disrupt our way of life. And it is possible. And that, in future, new viruses or new variants of virus, some of these viruses might come in. But, hopefully, through science and through medicine, we'll be able to contain them. And of course, we need to also think about the sustainable ways of limiting our exposure to the viruses that we are not exposed to.
Great. For the audience, I want to talk about one book that I read. I'm really inspired by this book called Moonshot from Dr. Albert Bourla, the then CEO of Pfizer. And he talks about how they were able to produce a vaccine in a short span of 9 months which typically would take a couple of years. It's very inspiring, and how different the versions were tested, and how he went by his gut to say, "Hey, let's start producing the vaccine." Incredible story by Dr. Albert. Doctor, you are also doing some work in Japan. I want to know more about what's happening in Japan.
So, I was since 2023, I've been working at one of the largest tertiary care hospital in Japan, which is a super specialty center for excellence in vascular disorders, in cardiovascular and cerebrovascular disorders, which is sort of a center for excellence in vascular disorders. So which is based in Osaka. It's the National Cerebral Cardiovascular Center, and I've been as the visiting director in neurology. Really been very grateful to, see patients, but also to learn a very different sort of, systems of medicine in Japan, and the minute details, and to the level of details and access to technology that Japanese hospitals have, the process of care, which is sometimes very distinct, um, and different, and the approach to medicine is quite different, if you may call it. So it's been an extraordinary, immersion to a different form, at a different country altogether. But also to work with some of the brilliant minds in medicine over there, to see, conditions which are rather limited, or in you don't see those conditions in other parts of the world, to that extent, for that matter. For example, CADASIL, which is caused by the Notch3 mutation, and many other from which is had a higher preponderance rates in East Asian populations, for that matter. So that exposure to diseases which you see, but you don't see to that extent in other parts of the world. But also the level and the quality of care in Japan is phenomenal. It's a public health system, robustly built, a super specialty center, one of the world's leading center in this condition. You get referral from all around Japan, and and the rapid access to right diagnosis, right treatment for these patients is something which is something which which I've deeply appreciated. In fact, I recently wrote an article about some of the learning lessons from my time in Japan for Australia and from the rest of the world. And one of these editorials were published in Nature Aging, and subsequently in one of the Australian portals in Indian Link, where I reflected on the challenge that both our populations are facing, and that this is the challenge of aging. Our populations are aging, and the rate at this aging is that probably Japan is at accelerated pace at this moment, but Australia will be getting there. India will be getting there. So Japan is giving a sort of a trailer to what's going to come in our part of the world. It is also giving a lesson in how do you look after elderly population, how to manage this population, prepare ourselves for this, and develop systems of care to look at populations at scale. Because it is, this is ahead of us now, and we need to be prepared to look after our aging populations, where diseases such as dementia, Parkinson's disease, multiple sclerosis, and so on and so forth. And how do we manage these patients? Patients who are, bedridden, patients who need, ongoing and long-term care, rehabilitation. The needs of aging populations are distinct from the needs of other patient populations. How do we prepare ourselves? All of us in Indian families and in Australia and otherwise, in all of us, we have seen our elderly parents or our grandparents go through this journey. And so this is a challenge that we all need to think about. And Japan, the system in Japan offers both a lesson and sort of a precursor to what's going to come here. So there's so much that we can learn from the health systems here in Australia and Japan, and of course in India.
Interesting. You know what? I'm just thinking every topic you touched upon can be a podcast episode, isn't it?
Thank you.
So, Doctor, you're so passionate about what you are doing. But I would like you to also share with the audience what are the challenges of being a world class neurologist? What is it that people don't see? And anybody wanting to be, in your shoes, anybody wanting to be a neurologist, they should be aware of what is going to come in their life.
It's a great question. I mean, there are great perks of this job. Like, I absolutely enjoy doing what I do. I'm very passionate about it. To be able to serve patients in various countries, to be able to interact and make a difference in people's life is an enormously gratifying, profession. And I'm eternally grateful to our patients, to our community. Um, but it does come with its own set of challenges, and I think the challenges of being far away from our families, not being there for your parents and loved ones. That's several part of substantial part of our commitments. I travel a lot. I travel to multiple countries. In fact, just a couple of weeks from now, I'll be in Japan for several weeks, and subsequently, I'll be going to other parts of East Asia. So there is a constant travel, and the working hours are rather long. It's quite demanding. You have you got to be prepared for work overnight. Sometimes the stretches of these work hours are rather long, and it takes. I would not deny that it takes a toll on your body, and beyond clinical medicine. Then for many of us who are also physicians, scientists, beyond clinical medicine, you also are involved in science innovation. We also have this, a sort of a duty of care to the young doctors, to train them. Many of them are pursuing fellowships in neurology, in neuroradiology. Some of them are training in medicine. Some of them are doing their PhD and postdoctorate fellowships. And I take this very seriously that, what we know today will only be preserved if we carry this forward. So training the next generation of doctors, all of this takes enormous amount of time, and doing it well, doing with empathy, looking after them, to see that they are, that they carry experiences which makes them, um, look at medicine not just as a provider, but as a as somebody who has an enormous potential to make a difference in the patient's life, in an individual's life, and from that individual's to the family's life, from that family to the community. And it's a ripple effect if you think about it. If you save one patient from having a lifelong disability, you change the entire family. And it has a ripple effect on the rest of the population. So, yeah, these have a toll, and lack of sleep for that matter. But I wouldn't do anything otherwise. This is something which I love and absolutely am passionate about. And but just on a side note, I think doing what you do, you got to also have some hobbies, and also pursue things which you like. And I love traveling, and I love writing.
Writing, okay.
I extensively write. I used to do painting when I was younger, but unfortunately now, putting that canvas is rather difficult at times. But I do extensively write, and I read a lot most of the times. I'm reading books in philosophy, and I'm learning languages. I love languages. I speak more than 10 languages, and I'm continuously learning new languages. It just gives me sort of, hunger that, hey, I'm going to go there and speak to the people in their
Your
language.
language, yeah.
And it's something extraordinary.
I agree. And when is your next book coming out?
Yeah, we've just published 2 books, which has just come out: The Grand Challenges in Cardiovascular and Cerebrovascular Disorders, and Mechanism and Treatment in Acute Ischemic Stroke. But there current are some others in pipeline, which will be announced, sometime soon. But we are continuously, publishing as well, and many of our work in clinical medicine, but also in global health, and some of the new innovations. So, for example, I'm very passionate about this new work that we have done in Parkinson's disease patients. And so we have basically proposed that that we witnessed that many of the select group of quite a substantial portion of the Parkinson's disease patients are being misdiagnosed. And the conventional treatments such as levodopa don't work on these populations. And we had radically defined a new sort of a phenotype of Parkinson's disease, not identified before, which has a predominance of the vascular endophenotype, uh, which is recently published in European Journal of Neuroscience, and watch this space in next couple of months over time, where we'll be putting out some more work that is coming out of our team in in understanding the vascular contributions to neurodegenerative diseases.
Amazing. Doctor, it would be unfair if I don't ask you if you are using AI in your work.
Oh, we are constantly we are developing AI models in and for example, one of the challenges that we were quite intrigued was that there is a phenomenon in stroke called futile recanalization. So what it basically means is that even if you provide the treatment to patients, not all patients respond, because in some patients, despite the treatment, you don't notice improvement in outcome. And the question was that why is it happening? And that why not all patients are responding to treatment, responding to, despite that we are doing the same systems of care, there are differences in outcomes in patients. And so we developed a machine learning model, training various variables to predict patients who are at high risk of futile recanalization. We are developing similar models for early diagnosis of atrial fibrillation. And that's why I often say that the medicine is moving from the conventional medicine to what we call precision medicine. That through that models that we are developing, and the great part of this that these are models that can be easily deployed and can be used in populations where they might not have access to the cutting edge technologies. But the knowledge systems that we have trained these models on can be deployed in other parts of the world in early diagnosis with limited number of variables for that matter. So our next phase of our work will be, developing and expanding these models, AI models for precision medicine, early diagnosis and treatment and monitoring of the patients for brain and cardiovascular disorders.
Great. Doctor, we are almost at the end of the interview. Would you like to say a few words for the youngsters who are listening to my podcast?
Oh, thank you once again for this wonderful conversation I think we had, and if I were to speak to the your audience and especially the youth and the young kids, and this is the message probably I'll share with you is this: that just be hungry, have an appetite, sort of yearning for what you do, and be passionate about it. There'll be a lot of challenges and naysayers, but believe in yourself that no matter where you come from, where you start, the start might be mediated by a lot of initial risk factors, for that lack of words, but your destination is yours. You can define where you want to be, but make sure that in that destination you have a purpose. That that you enjoy getting to that place of your choice, whatever that place is. Whether you want to be a great scientist or a doctor or a policy maker, or you want to work with government, or you want to support vulnerable populations, whichever sector you want to work at, we all have an enormous ability to contribute and give back. And I think that giving back gives you this, sort of to keep going. Rise up every day, even if you're tired, with little sleep, but you get up next day with the same sort of passion that you had 20 years, 25 years ago when you were, when you were still understanding what medicine is about. You still carry the same sort of passion for medicine. And that'll never die because, it's not just a routine job for you, then it becomes your lifelong mission. So I would, my sort of appeal to the young, youth would be that, pursue what you deeply care about, but pursue that with purpose. And as long as you can link the two, sky and beyond is the limit. There's nothing that can stop you. And and once again, thank you very much for your invitation. I absolutely enjoyed this conversation, and let's keep talking.
Amazing, doctor. I mean, I learned a lot from you today, and thanks for this incredible conversation. Today's discussion was about purpose, discipline, and choosing impact over comfort. To every young person watching, you don't need all the answers today. What you do need is curiosity, consistency, and courage. Start small, stay focused, build yourself every day. Because the world doesn't need another successful people, it needs thoughtful, purpose driven leaders. Dr. Bhaskar, thanks again for joining us. And to everyone listening, keep learning, keep thinking, and try to build something. Thank you.